My name is Silvie. I'm an evolutionary biologist and assistant professor at the Center for Evolutionary Medicine at Arizona State University. So in this poster presentation, I'm arguing for the need for more evolutionary theory in malaria control and elimination programs, and specifically for the need of the inclusion of evolutionary biologists in already multidisciplinary teams. So we all know drug resistance and insecticide resistance are major problems for malaria control and elimination. So the thing is, these are evolutionary problems at heart. And if we understand the exact drivers of resistance, we can manipulate the system in such a way to minimize the selective pressure for resistance. So for instance, we currently do combination therapy to reduce the likelihood of resistance to emerge. So this is with artemisinin combination therapies, for instance. However, why don't we do the same for insecticides? Particularly with new insecticides soon coming on the market, this is a time to protect our new chemistries from resistance evolution. Also, some people may have heard about rotating multiple first-line treatments or randomly applying them at patient level. However, we don't really have a good grip on how well they would work. Which one would be best and how should we apply them? So for instance, at which frequencies should drugs be rotated? At which spatial level should insecticides be randomly applied? Should this be at house or neighborhood, village or district level? But apart from these, there are multiple other resistance management strategies. Some of them more commonly used in agriculture. So here on the right, I'm giving some examples of some published studies on evolutionary refugia, for instance, reducing exposure dose, the evolutionary dead ends, intentional evolution of repellency, late life acting insecticides, resource limitation, and I would really encourage you to have a look at some of these papers that are given at the bottom of this poster. But apart from this, there are other outstanding questions that aren't answered yet, that are very relevant for malaria elimination. So first of all, is it really possible to evolution-proof a chemical? And then, do bed nets really need insecticides? And then on vaccines, are vaccines going to be evolution-proof? I would argue that they wouldn't. Does insecticide resistance impact malaria transmission? So interestingly enough, we don't really know the effect of insecticide resistance on malaria epidemiology. What are the evolutionary consequences of gene-drive mosquitoes? Are they evolutionary proof? Does mass drug administration increase or decrease the spread of resistance? We actually don't really know and don't have a lot of good data on this. And then lastly, should there be a one-size-fits-all resistant management strategy? And unlikely so. If you want to know more about this, please have a look at our paper that was published last year in Evolutionary Applications. And then please also just send me an email when you have any questions or any comments about this. Thank you very much for watching.